Schizophrenia. The word alone probably brought a few images to the front of your mind, and if it did, those images probably weren't pretty. That's because schizophrenia has one of the worst reputations of all mental illnesses. There are several stereotypes that are associated with the illness, even though there are several types of schizophrenia. Schizophrenia's tendency to be misunderstood probably has a lot to do with the fact that, even among professionals, it isn't fully understood. The illness is as mysterious as it is notorious, which has led to serious complications when it comes to treatment. Perhaps the most mysterious thing about schizophrenia is its origins. But recently, researchers found a possible lead as to where schizophrenia comes from. According to their research, one of the most stigmatized illnesses of the mind may start with a problem in the blood. Imagine you are a young adult who has lived a relatively healthy life so far, but you start to notice little changes. Perhaps you start to hear things, or maybe you even see or smell things that no one else seems to notice. You think it's just your imagination being overactive, but over time, the sensations become stronger and you realize you aren't imagining anything. You're hallucinating. These are just a few of the symptoms of schizophrenia, and experiencing hallucinations is not at all a guarantee that you are schizophrenic, but for many schizophrenic people, this is how it all began. Because of the hit-or-miss treatment options available today and the stigma associated with schizophrenia, being diagnosed with the illness can be the worst news for a young adult to receive. Now, imagine living with schizophrenia and being told that you also have cancer. This may seem like a hopeless diagnosis, but for a 24-year-old patient, it was this diagnosis that eventually led to his reclamation of his mind. The patient had treatment-resistant schizophrenia and was diagnosed with a form of leukemia. In order to treat his cancer, doctors decided to perform bone marrow transplantation, or BMT. After a successful BMT operation, doctors were amazed to find that the patient also showed signs of reduced psychotic symptoms, and he showed this reduction without a change in his treatments for schizophrenia. Of course, this one result wasn't enough to constitute a clear link, but after his 2- and 4-year evaluation,